The first disease of the lower respiratory tract that your book mentions is Legionellosis. Legionellosis is a disease otherwise called Legionnaire's disease, and it's transmitted by Legionella bacteria. Legionella bacteria are often contained and transmitted by air conditioning units or other environments where there's a lot of moisture. These diseases are also transmitted through the air and infect the lower respiratory tract, leading to symptoms such as fever, cough, chills, headache, and pneumonia. Older people are much more susceptible to this disease, especially if they're smokers, than younger individuals. When death occurs, it's usually attributable to shock and kidney failure, because these diseases can end up being prevalent throughout the body. Unlike bacterial meningitis and whooping cough, Legionnaire's disease is rarely transmitted from person to person, but is instead transmitted from water sources such as air conditioning units, hot tubs, drinking fountains, and water fountains. These water sources then aerosolize the bacteria, and the aerosolized bacteria are inhaled by the unknowing victim. Because Legionnaire's disease is transmitted by air conditioning and water sources, it can also be transmitted in hospitals as well. About 76% of Legionnaire's disease infections occur in hospitals, and as a result can lead to a number of fatalities because these people are already sick with other ailments. The other type of lower respiratory tract infections that your book mentions is tuberculosis. Tuberculosis is otherwise also known as consumption, white plague, and white death. This is also referred to as TB. All of these are a result of the fact that victims of tuberculosis are often eventually really thin, pale, and weak, and appear to be consumed by their illness. Tuberculosis is still very common worldwide, though in the United States it has become a rare disease as a result of preventative measures and modern medicine. In the past around the world, tuberculosis was exceedingly common, accounting for as many as 15 to 20% of fatalities. However, as a result of vaccines in the 1920s and antibiotics in the 1940s, treatment in some industrialized countries started to alleviate the incidence of this disease. Unfortunately, in the United States and other industrialized countries, we are starting to consider tuberculosis as a re-emerging disease. The reason for this is that not many people in the United States get vaccinated against tuberculosis anymore because it is not common, and there are a number of antibiotic-resistant strains developing and being brought to the United States from those who travel around the world. The disease itself is transmitted by the microbe Mycobacterium tuberculosis, which is a bacterium that resides in the lower respiratory tract and can be coughed up or sneezed up or even expelled during talking, singing, or laughing. People become at even greater risk of acquiring tuberculosis if they are in extended contact with an infected person in an enclosed space. This includes family members, friends, coworkers, and also transmission in schools and airplanes as well. Anybody can be infected with Mycobacterium tuberculosis. It's not a disease that just impacts the very young or the already sick. Before pasteurization, milk was a significant transmitter of tuberculosis. Less commonly, the bacteria can be transmitted on the skin and in people who have received tattoos. The first time you are exposed to tuberculosis, you'd acquire what's known as a primary infection. In most cases of primary infections, there are no symptoms, and the individual doesn't even know that they are infected. They cannot transmit the disease either, and thus the microbe just resides within the lower respiratory tract in lesions known as granulomas. If the immune system is weak, such as those who are children, the elderly, or people with compromised immune systems, such as those with HIV and AIDS, the microbes can escape the granulomas and cause symptoms associated with the disease, such as fever, night sweats, weight loss, fatigue, and coughing up of blood. However, these granulomas can reside in the lungs for extended periods of time, and so someone who acquires the disease early in life can harbor the granulomas for a lifetime, only acquiring the symptoms when they get older and their immune system becomes weaker. These microbes in the lower respiratory tract can also escape the granulomas to other parts of the body as well, including the brain, spinal cord, kidney, bone, or skin. Secondary tuberculosis can result when these additional sites have microbes that are growing there. And the bacteria, which have remained in a dormant state for years, can be reactivated decades later, affecting these additional anatomical locations. Mycobacterium contain mycolic acids in their cell wall, which prevent the use of Gram stains. Therefore, anyone suspected of Mycobacterium infections can be diagnosed with the Ziehl-Neelsen staining procedure or acid-fast staining procedure. These microbes can be identified in the sputum or mucus that individuals infected cough up. Here in the United States, an alternative means of preliminary diagnostics of tuberculosis is used. Here in the US, we use a diagnostic test called the tuberculin skin test, or TB test, where the tuberculin toxin is injected just underneath the skin and an immune response is assessed a few days later. If the immune response indicates that the individual has been exposed to tuberculosis, additional tests of sputum or X-rays of the lungs looking for granulomas can be done. However, most individuals that have not been exposed to the vaccine or the microbe will test negative for the TB skin test, and no additional testing is necessary. Any individual that has confirmed tuberculosis infections, either from a blood test looking for antibodies or looking for DNA or nucleic acid tracers of the microbe, is then put on antibiotic regimens. The disease is treated by 6 to 9 month course of antibiotics, along with supportive measures that allow for adequate rest, a good diet, and oxygen therapy. The reason why antibiotic treatments for tuberculosis require 6 to 9 months of antibiotics is because this microbe has a very slow generation time and thus responds very slowly to antibiotic treatment. The 6 to 9 month antibiotic treatment is also part of the reason why we see a dramatic increase in antibiotic-resistant strains of tuberculosis. Individuals that do not stick to this antibiotic treatment for this lengthy period of time can allow for the evolution and development of antibiotic-resistant strains that are far more difficult to treat. In an effort to prevent these antibiotic-resistant strains from growing even more out of control, the World Health Organization has developed what's known as DOTS, or Direct Observational Therapy Short Course, in which case doctors actually watch the patients swallow the antibiotic treatments over this extended period of time. This very time-intensive treatment on the part of the doctors that have to physically watch the patient swallow the antibiotics has allowed for a much higher cure rate of tuberculosis in many countries around the world. Despite these preventative measures, however, there's still an increase in antibiotic-resistant strains of tuberculosis, including MDR-TB, or multi-drug-resistant tuberculosis, and XDR-TB, or extremely drug-resistant tuberculosis. These different strains resist a number of different antibiotics and are becoming more and more resistant to antibiotics every year. There is a vaccine against tuberculosis, but it is only used in developing countries where tuberculosis is fairly common. That's because the protection rate is only about 80% in children and less than 50% in adults. This vaccine is not used in the United States because tuberculosis is not very common here. And us not using the vaccine allows us to use preliminary diagnostic procedures such as the tuberculin skin test. If we started needing tuberculosis vaccines in the US, we wouldn't be able to use the TB skin test anymore for diagnostics and would have to result in blood tests or x-rays in order to diagnose patients with tuberculosis. Mycobacterium tuberculosis is an extremely deadly disease worldwide. It kills over 1 million people every year around the world, and over 10 million people carry tuberculosis in their lungs. It is particularly common in India, Indonesia, China, and is the leading cause of death of people with HIV and AIDS. There are other species of Mycobacterium that can cause infection as well, but these species are much more likely to cause infection in people who have compromised immune systems. Mycobacterium avium and Mycobacterium intracellulare can be carried in waterways, shower heads, water faucets, and can be aerosolized as well. However, they usually don't cause disease in healthy individuals and can be found primarily just causing disease in children and HIV and AIDS patients. In the next section, we'll be talking about sexually transmitted bacterial diseases, finally leading up to contact diseases or diseases transmitted on the skin.